So it does have an increased transmission capability. However, when you look at the cases, they do not appear to be any more severe, and they do not appear to evade immune responses either from vaccines or prior infection. So the bottom line is we likely will see an uptick in cases. Hopefully we won't see a surge. I don't think we will. The easiest way to prevent that is to continue to get people vaccinated, and for those who have been vaccinated to continue to get them boosted.
So that is Dr. Fauci talking about the BA2 variant of COVID, which you've probably already heard a good amount about. Regrettably, probably gonna hear a lot more about it, because while he seems relatively confident that there will be an increase in cases, but the cases will not be any more severe than they were with Omicron, which is also considered the BA1. This is a variant on that. He also does stress you should really be getting vaccinated. And more people have, but there's still a solid quarter of the country that hasn't, leaving us open to possible infection and reinfection. You might have seen in the news that Jen Psaki just got COVID again. Hillary Clinton as well, another senator getting it. It is still spreading. So I want to give you a little bit of basic information about the BA2. It's a new version of the virus, a descendant of Omicron, already creating surges in some parts of the world. Data from the UK show that country's rise in infections began around the same time that BA2 surpassed the 50% mark of overall cases. It's not to that point in a lot of areas of America, but it is starting to take over as the dominant strain. Understand that viruses mutate constantly, mostly in harmless ways. There's no current evidence that BA2 is more virulent, spreads faster, or escapes immunity better than BA1. That is not a proof that will not be seen, but right now we don't see it at this point. But this is happening, the possibility for an uptick in cases. At the same time that, if we can jump ahead to Dan Diamond, White House reporter for Washington Post, the White House says we don't have the money anymore to ensure every American can get a 4th vaccine dose, to buy a variant-specific vaccine for BA2 or other variants that might come after that. And the Democrats don't seem to have much hope or drive to increase the funding. So all of this is leading to potentially a scary rest of the year, although probably similar in a lot of ways to the situation with Omicron. Brett, what do you think?
This is so exciting. I'm so happy for BA2. I call it the master's degree because it's like your second associate's degree. Are you filling out your bingo card? How quickly before someone calls this the BS, BA, more like BS virus coming out your two like some like it's stupid. This is, I never know how to respond to stories like this. I thought we were moving on to QAnon, but anyways.
Well, in that case, if you'd like, I can give people a little bit of an update on the current status of things. If we can jump ahead of this chart, you'll see we are finally getting down to about 1,000 deaths from COVID a day. We're not quite there yet, but all of these numbers are trending down in the way that you would want them to. We're still at about 30,000 cases. We're still not at the lowest point we've been since this thing began, but just be responsible. We're going in the direction everyone says they want us to, but will everyone do what they need to continue it? That's what we're gonna have to wait and see.
Listen, I wish that Trump came up with a better vaccine that actually stops this thing, but he didn't. And so we have to deal with it. And because the Trump vaccine does not stop COVID dead in its tracks, we have to deal with getting vaccinated so that we reduce our likelihood of hospitalizations. And we still have to push for more financing so that we can fast track a more effective cure, a vaccine, and most specifically, if everybody agrees that treatments for this do work, we got to get them funded. We got to get them free for people to use, and we can't leave it to the insurance companies to put a price tag on it, because that price tag will continue to the prevailing dominant dynamic in American healthcare, where Americans, despite being in the richest country the world has ever or will see, we still pay twice as much for healthcare, and we die sooner than people with nationalized healthcare.
Agreed. By the way, I'll close. I saw in the chat a couple of people were like 1,000. Yes, we're still above for months now. We've been above 1,000 a day. Does everyone not know that? A lot of people are still dying, everybody.
For more political news breakdowns, interviews, stories of activism, and me trying my hardest to care about the occasional big celebrity news story, subscribe to our YouTube channel at youtube.com/thedamagereport. And you can ring the bell wherever it is so you don't miss anything.